All right, hello everyone. So I'm going to be talking about some general medical conditions or gen med. So just some quick basic definitions. I'll try and update these as semesters go on questions that people ask from me. So etiology is the cause of the disease or condition. Antipyretic, used to prevent or reduce fever. Okay, so like Tylenol, acetaminophen, same thing, but very common ones. Malaise, general feeling of discomfort. Analgesic, some kind of drug or painkiller. Uh, Now, the next few signs and symptoms. So those are used together, but they have some different meanings. So a sign is very objective. Okay, it's something that can be measured by someone else, or a symptom is very subjective, which is usually expressed by the individual. For example, I have a headache. Is usually pretty much subjective. So that is a symptom, okay? Because you can't really measure a headache. You can kind of roughly estimate that. Like, let's say use the 0 to 10 or 0 to 20 scale, okay, on how bad your headache is. Well, that is very subjective to the individual. Like, how bad is their, like, what's the worst pain that they've ever felt? Is it a broken bone? Is it a scrape? Well, a broken bone to one person is a 10, but a 10 to someone else that has not experienced that is going to be dramatically different. So usually stuff that you can measure is going to be usually like pulse, blood pressure, items like that, for example. I mean, the list goes on. Nothing's coming to mind right now. So stuff that you can measure is a sign, and the symptom is something that's usually expressed. Okay. But for most times, we'll put in this, I'll do like signs and symptoms because I usually just combine them all. But just know the difference between the two. All right, we're going to start off first with viral infections. Okay, so the rhinovirus, okay, that was a common cold. Okay, it's still a virus. Okay, usually not a bad one. There's over 100 different rhinoviruses, probably in the thousands, I bet. It transmitted either direct or indirect contact, sneezing, coughing, speaking, touching, anything that you can kind of come in contact with. Okay. Depending on the rhinovirus, could live on, could be more focused on hot temperatures. Most are on cold temperatures. Some can last on surfaces different lengths of time before they die. Let's see, signs and symptoms. Okay, so begin with a scratchy sore throat. Okay, stopped up nose, water discharge, sneezing. You can also produce some thick yellow nasal discharge. Okay, from your nose usually. Usually, that indicates some kind of like infection in a way. All your nasal discharge should be clear. It doesn't mean like you're gonna die or have COVID or anything like that. It just means that you have some kind of like rhinovirus or cold. Okay. Nasal discharge, watery eyes, mild fever sometimes, sore throat, headache, malaise, again, the feeling of discomfort, myalgia, dry cough. Secondary kind of infection you can get is laryngitis, tracheitis, acute bronchitis, sinusitis, and otitis media, or any kind of anything eating an itis. Itis just means inflammation. Just know that. So whatever it is, so like bronchitis, inflammation of your bronchioles, for example. Okay. So management. Okay. Symptomatic treatment. Okay. So symptomatic treatment is just like treat your symptoms. Okay. It'll last about 5-10 days, give or take. Non-prescription cold medication, so over-the-counter stuff. Eat a good balanced diet, drink lots of water, avoid any extreme stress, emotional, physical, so forth. That's just going to take away all those reserves that you have to fight that cold and use it for other unneeded things. Like if you have a cold, don't go run a marathon or don't go work out. Really, like just take it easy and it'll resolve faster. All right, influenza. So influenza is the flu. Okay, the full name is influenza. There's caused by the myovirus A, B, and C. Okay, type A is most common. Virus enters through the cell genetic material. Other epidemics that we have come in contact with for type A is H1N1, which is the swine flu. And then there's the avian flu, which I'm actually not too knowledgeable about. I don't think it was too common in the U.S. Don't quote me on that one. So signs and symptoms of flu. Okay, fever is usually decently high. Okay, 102, 103. Chills, cough, headache. We've all experienced the flu at some point. Like the flu, like the common cold, affects everyone a little differently. Like the cold, for example, doesn't hit me really too hard. I might just have like a runny nose and that's it. Where the flu just knocks me on my butt. My wife calls it the man cold. Anyway, she gives me a lot of grief on that. But usually like sweating, weakness, fatigue, aches and pains, body aches, and so forth. So management, okay, bed rest, okay, supportive care, treat the symptoms. Nothing you really can do for it, but just let it take its course. Aspirin, Tylenol, if you have them, okay, good use. Don't over medicate. Steam inhalation for any kind of cough symptoms usually works pretty good. Gargles, you know what to do. Okay. In terms of like meds, I wouldn't go like crazy for some of them just because you're just gonna treat the symptoms. Okay, but don't like over medicate yourself and OD. Okay, that's always a big thing. Lay low, let it take its course. The flu can be really infectious to other people, so just try and like just let it take its course. Best way of saying it. One nice thing about COVID is everyone's treating flu-like stuff more serious. Me personally, instead of me going into like work because I had no one else to cover me for practicing reasons and all that stuff, because I had a flu, because that's usually how it was. A lot of people are actually like being more responsible about it and staying home. A lot of it there's new like work laws around that, but now everyone's treating it more serious, which is nice. All right, infectious mononucleosis, or the kissing disease, or everyone calls it mono. Okay, so that's caused by the Epstein-Barr virus. Okay, which is kind of a member of the herpes group. Doesn't mean you have herpes. So it has incubation period about 4 to 6 weeks. Okay, so it takes a good amount of time. Transmitted through saliva. Signs and symptoms. Okay, the first 3 to 5 days: severe fatigue, headache, loss of appetite, myalgia. About 5 to 15 days. Okay, fever, swollen lymph nodes, sore throat. Half the people will experience a large spleen. Okay, so that's very, very important on the large spleen for athletics, because mono, even after the point to where like you don't have a fever or anything like that, if your spleen's enlarged and you get hit there, like contact sport, whatever, full partial contact, there's always, in almost every sport, there's some kind of partial contact. Your spleen could rupture. So that's a big thing of in terms of like sport-wise to not go back, because that could, one, extremely painful if that ruptures, and two, could kill you. Okay, so that's why mono is such a big thing to kind of, all right, for one, don't spread it, and two, no contact sports or really extreme things. Okay, so management, support symptomatically. I would check with your doctor to see like any other tests or anything else that he wants you to do. He might give you some like better drugs for that. Acetaminophen for headaches, fever, and discomfort. Acetaminophen is just Tylenol. That's all it is. That's the drug name is acetaminophen. Resume training if you're doing any of that after about 3 weeks. Okay, make sure you're cleared by your doctor for that. Otherwise, things can get worse. All right. Next is respiratory conditions. Okay, so sinusitis, tonsillitis, rhinitis, every other itis in here. All right, sinusitis. Okay, stems from an upper respiratory infection caused by a variety of bacteria. Okay, signs and symptoms: nasal mucus swell and blocked sinus. Painful pressure occurring in accumulation of mucus. Skin over sinus may be swollen, painful to touch, headache, malaise, purulent nasal discharge. Management. Infection is purulent. Antibiotics may be warranted. Steam inhalation and other nasal topical sprays. Well, I'm going to try this. Oxymmelozone can produce vasoconstriction and drainage of your sinuses, which can help. And steam inhalation, the best way to do that, take a hot, steamy shower. Okay, that can help just kind of loosen up everything in your sinus and let it just kind of drain out. All right, tonsillitis. Okay, acute inflammation and bacterial infection of your tonsils. Signs, symptoms. Okay, tonsils appear red, swollen. You have these yellow kind of like pits in there, you'll see. Pain with swallowing, high fever, chills, headache, neck pain. Sinusitis, atopic media, which is kind of like that ear infection. Tonsillar abscesses may develop. Management, okay, get checked for strep. Okay, that's really, really important. Gargle with saline water, liquid diet, antipyretic meds. I think that's really it for the most part. A lot of times they might even go in and like just take out your tonsils. All right, seasonal atopic rhinitis. So this is everyone in the Central Valley that has allergies, which is 95% of the population. All right, so I do not have allergies, so I just see everyone else struggle, and I think I am blessed. So like hay fever, pollinosis, all the allergies. Some people are affected worse than others. The valley is not a good area for if you have allergies, just because we have so much pollen, dust, mold at times, a lot of stuff in the air, obviously, if you've ever lived here. I lost my train of thought. So a lot of people have a lot of these. So airborne, like fungal spores are really common. Cause a lot of like histamine releases, which is kind of like make you like teary-eyed, swelled up, nasal run, eyes cry, itchy throat, irritability, problem sleeping. What else? Cough, wheeze. Oral antihistamines and decongestants are probably the best thing you can do. Just know that the decongestants force you to cough. Okay, it's not a cough suppressant. It forces you to cough up all that kind of phlegm and stuff in your lungs, which is good to get it out, because then like you'll obviously stop coughing after a while. But that's what that kind of like decongestant does. It helps just kind of gets everything kind of out of you. All right. Pharyngitis, okay, sore throat caused by usually a virus or strep. Okay, not saying that all sore throats are strep related. Transmitted by direct contact, infectious person, whoever the carrier is. Signs, symptoms: pain, swallowing, fever, inflammation, swollen glands, malaise, weakness. Mucous membrane may be inflamed, covering of the matter. Management, okay, throat culture, make sure it's not strep. Okay, always a big thing. Antibiotics will be prescribed if it is some kind of strep infection, or sometimes they might prescribe it just to get rid of whatever that bacterial infection is. But most of the time you just have to like let it take its course. All right, acute bronchitis. Okay, so infectious winter disease that follows usually the common cold or viral infections. Fatigue, malnutrition, becoming chilled may be predisposing factors. Okay. Signs, symptoms: okay, upper respiratory infection, nasal inflammation, profuse discharge. You could have a fever, sore throat, especially from all that drainage going back into your throat from your nose, and back muscle pains. Okay, or just that general is like muscle aches. Fever can last 3 to 5 days. Cough can last 2 to 3 weeks, roughly. Yellow mucus indicates infection. Just know that. Management: avoid sleeping in cold environments. Avoid exercise in extreme cold without some kind of protection. Usually it's just wearing a mask or like a scarf around your face in like extreme temperatures. But even if you wear some kind of, I guess masks are more common nowadays, that just helps you breathe in more warmer air to avoid some of this. Rest until fever subsides. Drink a lot of water. Eat good. Cough suppressants, antibiotics, any kind of over-the-counter thing that you may need to treat symptoms. But not bad. Just get checked out by your doctor. Make sure there's nothing else that's worse. All right, pneumonia. All right, so it's infection of the alveoli and bronchioles from whatever the viral, bacterial, or fungal is. Fungal pneumonia is the worst. It lasts the longest. I'm not saying the viral and bacterial are any better, but the few fungal pneumonia individuals that I've seen usually pretty much knocks them on their butt for months at a time. Pneumonia can be brought on by irritation from chemicals, aspiration. The alveoli it kind of gets like really inflamed. Signs and symptoms: bacteria can cause rapid onset. Usually you're going to have usually high fevers, chills, pain with breathing, decreased breath sounds, rhonchi, that's a type of kind of breath sound, coughing. You cough up that yellow sputum. Rhonchi, what's the best way to describe it? What's it sound like? I don't have a good one, but it kind of sounds like a velociraptor in a way. Viral pneumonia will go on for several days to weeks. Patients will have low-grade fever, muscle aches, fatigue, coughing. It's really a really bad respiratory infection. Other signs and symptoms: certain types of fungus can also cause pneumonia. When fungus is inhaled, some individuals will develop acute pneumonia. Others will experience a form that develops slowly and lasts for months. Management: antibiotics, breathing exercises to kind of removal of that kind of sputum through that heavy coughs, analgesics, antipyretics. Make sure if you have pneumonia, make sure you see your doctor. All right, bronchial asthma. Okay, so the exact cause of asthma is unclear because there's different kind of forms of asthma. Okay, there's metabolic acidosis. Okay, there's post-exertional hypocapnia, which is low carbon dioxide in your body. Stimulation of tracheal receptors, physiological reasons can trigger that, like you get scared, panic attacks, so forth, can bring on asthma. Exercise induced. And usually this could be a kind of secretion. Can you open this up a little more? It's not only doing it. Usually it's a narrowing of your airway, or it's excessive mucus production in there. Spasms of smooth muscles of your bronchioles, edema up in there. Edema is just swelling your way. Difficulty breathing, hyperventilation, dizziness, coughing, wheezing, shortness of breath, fatigue. Most people have asthma. A lot, believe it or not, there's like 50% plus of the population probably has it. Management: regular exercise. Exercise is actually good. You can condition asthma. Just know that. If you do it appropriately. Don't do like just balls to the wall, 100% right off the bat. You're gonna need warm-ups, cool downs, increase your intensity gradually. Wear a mask and avoid cold, dry air. Okay. Warm, humid environments is best. Avoid exercise in high levels of pollution or high pollen counts, which is the valley. Usually you use some kind of bronchodilators. Okay. Albuterol is the common one, so you usually have a little dosage like right here. Okay, so it's usually some kind of little container. You see here. Goes in the inhaler. Athletes, if you're competing, especially ones that get like drug tested, make sure that the medication they're using is legal for competition. I don't know of the illegal ones, but there's always some factors, especially if you get drug tested. Okay. And one, if you do get drug tested, you do have to disclose that, hey, I'm using an inhaler and which one and so forth. There are some other prophylaxis treatments. They usually last about 12 hours. But these could look like a regular inhaler, but it's not for emergency situations like albuterol is. So going back to inhalers, I don't want to move on just yet. So the people, backtrack my train of thought. When you're first learning to use an inhaler, it's really, really important to use it a certain way. You can't just gotta go and like squeeze it and like life goes on, especially if you're having an asthma attack. So the people that do have asthma, when they first started using this, is probably a little scary for one, because if you're having an asthma attack, it's pretty much like a panic attack in a way. You have a hard time breathing. They will be freaking out. So if you do have asthma, if you just remember like your first like few like episodes and how kind of like scary it was, and you kind of learn how to do this appropriately. One, if someone is having an asthma attack, I won't give them this until they've calmed down. Okay, once calm down to the point of they're more composed, because then their inhaler is going to be significantly more effective. Okay, if they're pretty much freaking out and losing their mind, this is pretty pointless, honestly. Okay, so I'm going to, if I'm helping out someone else, I'm going to get right in front of them. Okay, and I'm like, all right, I will give it to you in a minute. I need you to calm down first. Okay, have them look at you. Okay, because if they're looking directly at you, you've now gained control. Okay, if they're kind of freaking out and their eyes are shut, in this case, you don't have control of the situation. Okay, have them look at you. Try and first kind of mimic their heavy breathing, and then try and slow it down. So, hey, take some deeper, slower breaths. Slow it down to a point. Okay, to where they can kind of control it, and then this is going to be significantly more effective. Okay, there's also spacers for inhalers. So a spacer is just, the cheap ones are cardboard, and the more expensive ones are just like a tube that attaches to the end of the inhaler. And it's about yay long. And all it is just a spacer. That way when they squeeze, push down the button up here, and the medication gets released, that's not just hitting their tongue or the back of their throat. Because the medication has to be mixed with oxygen and inhaled to be effective. Okay, so if I don't have a spacer, I'm not going to put this to their mouth. I'm going to hold it like an inch or two away, and I'm going to be like, all right, 3, 2, 1, and then they got to hold it in for about 10, 15, 20 seconds if they can. Okay, and I'll give them usually 2 pumps of this. Okay, but for the people that have asthma and they kind of been going through it for a long time, I'll just give them their inhaler. They know what to do. They're usually pretty calm about it, and they'll take it, and life goes on, because they know how to calm themselves down. They know that they can put this to their mouth and breathe it in, and not just have the medication like hit their tongue or the top of their mouth, and then that's it. Some side effects of albuterol is they can become lightheaded, very common. So just know that. So I won't give them any more than 2 puffs. But very, very important, that they inhale it, not just have the medication just hit their throat, which is harder for some of the like younger kids when they're still learning about it. All right. Now, a few nervous system disorders. First, we'll talk about is meningitis. So, meningitis is inflammation of the meninges, which is a kind of connective tissue, if you will, that surrounds the spinal cord and brain. There's different layers of your meninges. It kind of keeps it isolated from everything else. That prevents bacteria from getting in. Keeps all your cerebrospinal fluid in. So usually when these kind of covers, these meninges get inflamed, you have meningitis. Hence the itis means inflammation. Uses some kind of meningeal bacterial. There's viral and bacterial meningitis. Can occur in all ages, commonly seen in college-age students living in dorms, military barracks, etc. Signs and symptoms, okay, high fever, stiff neck, intense headaches, sensitive to light and sound. Meningitis can kill you, okay, very, very important to get that checked out immediately. Progressive vomiting, convulsions, coma. Okay, so the big ones is going to be the high fever, the stiff neck, and intense headaches. Okay, these are what they try and look for, like when babies, when they first go in, infants, when they first go in, and like they're just like crying uncontrollably because obviously they can't speak, and they can't turn their head because it hurts too much. All right, then they'll be checked out for any kind of meningitis. Management. Okay, so our cerebrospinal fluid must be analyzed for bacteria and white blood cell counts. If bacteria is found, isolation is necessary for 24 hours because it's very, very contagious. Antibiotics must be administered immediately. Monitoring in the ICU. If an individual has become in contact with someone that is contagious, prophylactic antibiotics should be administered. No specific treatment exists for viral meningitis. Again, there's no viral meds. Just know that everything's bacterial, really. Most recover completely on their own. Recommended bed rest, fluids, meds or fever, and headache relief. All right, MS, multiple sclerosis. So this is an autoimmune inflammatory disease of the central nervous system that causes deterioration, damage to the myelin sheath, and disruption of the nerve conduction. Okay, so the myelin sheath is this kind of sheath that goes over your nerves and it makes them more efficient. Okay, most of our body functions are done through our nerves that are myelinated, and so if you don't have that myelin sheath, you're very I don't want to say uncoordinated. It's true, but not to its full extent. You could be delayed. You're not going to function appropriately. Okay, so signs and symptoms: clear blurred vision, speech deficits, tremors, muscle weakness, numbness, tremor, spasticity, neurologic behavior, mood swings, may progress slowly, or may have acute attacks following partial or complete temporary remission. Okay. Management, okay, deal with symptoms as they occur, avoid overexertion, extreme temperatures, stressful situations. Exercise routines, very, very important. Drug therapy, slow down progression. The drug therapy in the last, I believe, 10, 15 years has been phenomenal. I do have a few friends that do have MS, and one most of her like symptoms kind of came on before a lot of the new drug therapies, and then one after the therapies came out, and the one that got it after all the new drugs is pretty normal. But my other friend that all this happened like kind of before all the bigger drug therapies does have a lot of issues, like eyesight. She can't really see too far. She's colorblind. As well as a number of other issues. A lot of people we probably know have some kind of form of MS. It's not too common, but it is out there. All right. Amyotrophic lateral sclerosis, okay, or ALS, also called Lou Gehrig's disease. Okay, so this is sclerosis of lateral regions of the spinal cord. along with degeneration of the motor units and significant muscle atrophy. Okay, atrophy is kind of wasting away of your muscles. Okay. So signs and symptoms, okay, difficulty speaking, swallowing, using hands, sensories, and intellectual function remain intact. Okay, rapid progression of atrophy results in paralysis. Okay, so there's no cure for ALS. Even after incapacitation, normal intellectual function remains, inability to communicate feelings and ideas. So with these kind of lesions on the spinal cord, okay, affects the motor neurons. So the motor neurons is the nerves that go and send signals to all your muscles. And so once it can't send signals to your muscles anymore, you can't speak, you can't move, you can't do anything, you can't move your eyes, but your brain's still there, functioning perfectly. So some things I've heard of is they kind of, I don't want to say go crazy, but I mean, what if someone just kind of bound you up and duct taped your mouth and blindfolded you and put you in a room forever? It's pretty much what ALS is long-term wise. Because you start losing all your ability to do everything. And there's no cure. I don't know the management for it, but it does affect a few people. All right, blood and lymph disorders. All right, first one is iron deficiency anemia, which is just anemia in itself. Okay, anemia is some kind of iron deficiency. Prevalent in menstruating women and males, okay, ages 7 to 14. More common in females just because of menstruation, they are losing some blood. 3 things occur during anemia, okay. You have small erythrocytes, okay. Erythrocyte is your red blood cells. Decreased hemoglobin. And low ferritin concentration. So that's a compound that contains a good amount of your iron. Okay. GI loss of iron in runners is common. Okay, GI is gastrointestinal. Okay, aspirin and NSAIDs may cause GI bleeding and iron loss. Okay, so an NSAID is non-steroidal anti-inflammatory drugs. So that is going to be your ibuprofen, your Aleve, are the common ones out there. So that is an NSAID, non-steroidal anti-inflammatory drugs. Okay. Menstruation accounts for most iron loss in women. Okay. Signs and symptoms. Okay. First stage of deficiency, performance declines. Patient may feel burning thighs, nausea, becoming, especially from anaerobic activity. Ice cravings is common. Okay. Ferritin levels must be assessed. Really in extreme cases. Management: eat a proper diet, red meats, dark poultry, avoid coffee and tea because that can kind of interrupt that kind of iron absorption. Vitamin C enhances absorption. Supplements is good but not the best. Okay, supplements, 1's expensive and 2's not as good as getting it through regular diet. Okay, not saying you have to get it through like meat alone. Beans, spinach, there's more, I'm drawing a blank right now, will have really high levels of iron. The highest item you can eat is liver. So, I mean, I've never had liver. I have no real interest of going out and like ordering liver. But that is a possibility that you can buy it pretty available to for this purpose. Broccoli, sorry, has good iron. So the best way to get it is through diet. Usually before you're going to have symptoms. Okay, so usually for like women that are menstruating, okay, before you start like menstruating is the best time to start eating more of these items. Also, if you have anemia, you have lower energy because iron helps transport oxygen, which helps keep you like awake. There's one more I can't think of the top of my head, but those are the common ones for anemia. Okay, runner's anemia. Okay, hemolysis. Okay, caused by the impact of the foot when it strikes the surface. Okay, not saying that all runners have runner's anemia. So that kind of impact, that intense like pounding of the feet, destroys the normal erythrocytes, red blood cells, within the vascular system. They can also become enlarged and kind of swollen. Not going to happen again with every single person that's a runner or female, for example, but it can happen. Okay, especially in runners. So management, okay, reduce distance, mileage, improve your footwear. So like the red blood cells, like in your foot, as you stomp, it just kind of damages them every time. And if you're a runner, or if you're not a runner, some of these runners can run 10, 15, 20 miles at a time. Okay, just think all those different heel strikes. I mean, that could be 10, 20,000 heel strikes a day. Easy. All right, sickle cell anemia. Okay, so sickle cell anemia is a hereditary disease. Sorry, not a disease. Is a hereditary condition that both parents have to pass on. And so the red blood cells become sickle-shaped. Do I have a next slide or so? I do not. So they go from the normal round shape to more of a crescent moon shape during intense events. Okay. When it turns to this kind of sickle shape, that kind of like moon, that lessens the ability to carry oxygen, limited ability to pass through vessels, and become clogged. So all your red blood cells are now all this like kind of sickle shaped. Can cause kind of clogs in your brain, in your lungs, in your heart, that can obviously possibly kill you. So some factors that can cause sickle cell anemia is acidosis, hyperthermia, dehydration, severe hypoxia, and which will also be brought on by high altitudes. Okay, signs, symptoms: okay, fever, pallor, muscle weakness, pain in limbs, pain in upper right quadrant, indicating possible splenic infarction. Infarction is just like no oxygen, okay, in your spleen from some kind of clot. Headache, convulsions. Management provide anticoagulants, okay, which is like a blood thinner in a way, and analgesics for pain. So sickle cell anemia is the exact populations that suffer from this most commonly are African Americans, Middle Eastern, and I can't remember the third off the top of my head. There's one more that are more prone to some of this. So obviously sickle cell anemia can kill you. So this is only the biggest thing this is the bigger item for like college athletics. So most like four-year universities, they have to either sign a waiver or get checked for sickle cell anemia. It doesn't disqualify you from participating, but it's one of those things that they need to keep in mind for emergency purposes down the road. Like if you have sickle cell anemia and you're going to a high altitude area that could bring it on, so your red blood cells go from that round to that sickle cell. Get my hand motions. That could kill you. So they keep in mind they have to have like high flow oxygen, or just oxygen in general on the sidelines, and then contact with the nearest hospital if that were to happen. Because if you have a blood clot go to your brain, well, that could give you a stroke. That is a stroke, or go to your heart, give you some kind of like heart issue, go to your lungs, and you can't breathe, and so forth. Or just get trapped in like your thigh, in your quad, and now you have excruciating pain like someone has a knife in your thigh. All right, next is diabetes mellitus. Everyone knows it's just diabetes. Okay, most common forms are type 1 and type 2. Type 1 is insulin-dependent diabetes mellitus. or IDDM, you might see it. And type 2 is non-insulin dependent diabetes mellitus, or NIDDM. Type 1 is usually brought on, I'm going to get ahead of myself in some slides. Type 1 is brought on by nothing that you can control. Okay, it usually comes on when you're a child to like late teen. You've seen it. Type 2 is brought on by usually obesity, inactivity, diet, so forth. Usually some diabetes is some kind of complete or partial decrease in insulin secretion or absorption. So signs and symptoms of diabetes is frequent urination. This is usually with type 1 that you're experiencing this. Is you're going to have the 3 Ps, which is the frequent urination, constant thirst, and constant hunger. So polyuria, polydipsia, and polyphagia. Okay, polyuria. Okay, poly just means multiple or many. Uria is urination, multiple thirst, and a multiple hunger. Okay, so that's a common one with type 1. Usually what's going to happen is because of all this kind of blood sugar that's in their blood from like type 1. So let me go back. I'm getting ahead of myself. So with your pancreas producing insulin, it's either producing insulin that your body doesn't absorb, it's not producing any at all, or it's producing a little bit, whatever it is. Okay, so usually type 1 is it's not producing any, okay, or your body just doesn't want to take it, okay, or not enough. That's really the thing. So type 1 is usually require an insulin shot. Type 2 is the best treatment for that is going to be diet, exercise. Nowadays, they will also prescribe insulin shots for type 2 diabetics to try and more manage their blood sugar. Okay, because you're just controlling the blood sugar in your body. And insulin, so you know, helps lower your blood sugar. It helps it so your body can absorb all the sugar in your blood, so you can use it for whatever it is, activity, function, storage, whatever it is. Otherwise, that sugar is just going to sit there and cause all kinds of problems. Okay. So for like type 1, I've seen this a few times in like late teens. Usually they find it early on in their childhood. To where they're going to have like the 3 Ps for 1, as usually be the big ones. It has to be checked immediately, which can, if it goes on for too long, they can threaten like the heart, kidneys, blood vessels, eye function, so forth. The time where I experienced it was someone that they just got like turned type 1. I don't want to say turned, but became type 1. He was a sophomore, junior in high school. Came in. I was athlete trainer at the time. He goes, Chris, like I had this intense headache. Like it's like migraine and it won't go away. So I'm like, all right. So I'm going through like the normal like protocols and taking like the histories and everything else from him. And as we're talking, he has guzzled 5 hydro flasks of water, and he just keeps refilling them up because I have a sink in my room. He was filling them up and drinking them to the point where I notice it because this is not like a common thing you'll see. And I'm like, how much water do you drink today? And he goes, I don't know. I just keep drinking it. I'm always thirsty. Like, all right, how many times have you peed? And he goes, I'm always in the bathroom. I'm either drinking water or peeing. And I'm like, are you hungry? And he goes, so hungry. And this is like 9 a.m. when I saw him. And I'm like, he's like, I already had lunch. I already ate my lunch I brought in and like snacks and everything else. I'm like, all right, we're going to walk you over to the nurses and we're going to check your blood sugar levels. I think it was like 800 was his level. And usually you want to be between like 70 and 110. Okay, so he was about 800, which is super high. So like insulin helped him, obviously, like he had to go like the hospital immediately for that. But that's for those people, like he was type 1. Okay, so type 1, like he was like skinny, lean, like he was athletic. Not always are type 1s like athletic or not, but he was just athletic. But they're not going to look like the normal diabetic individuals. Okay, because normal like type 2 diabetic individuals, they're obese, overweight. It's usually the common like look of them. Not to try and like stereotype, but they're usually overweight. Okay. So management is going to be diet, exercise for both type 1 and type 2. Okay. Even for type 1 individuals, diet is really good because it helps make any insulin more sensitive. Okay, so they don't need as much. Type 2, obviously, exercise and diet is really good for them to try and, 1, make them more sensitive, 2, to kind of bring everything back to under control. Diabetic coma is kind of loss of sodium, potassium, and the ketones body through excessive urination. Okay, so you're going to get what's called ketoacidosis, which is really high blood sugar, okay, in a way. And their sugar levels are so high that their breath is actually fruity smelling. Okay, that's a number. That's a big indicator. Given with the story I told you earlier, I did not smell his breath because it's a little weird for me to be that close. But that is a kind of like sign. Nausea, vomiting, thirst, dry mucous membrane, flushed skin, mental confusion, unconsciousness followed by coma. Okay, because the sugar is so high in their bloodstream that their body's not absorbing it at all. Okay, so that's where they need the insulin so the body can absorb that. Okay, management early detection is critical as this is a life-threatening condition. Insulin injection can help prevent coma. Okay, so that is diabetic coma, and now we have insulin shock. So okay, these are the extremes. Just, so insulin shock occurs when the body has too much insulin and too little blood sugar. So this is when your blood sugar is really like low. Signs, symptoms, okay, tingling in the mouth, hands, other parts of the body, weakness, headaches, abdominal pain. Respirations are normal to shallow, rapid heart rate, tremors, irritability, drowsiness. Management, adhere to a carefully planned diet, a lot of snacks, especially before activity. So insulin shock is more common than diabetic coma. Diabetic coma is going to take a long time to come on. Okay, that could take weeks to months. Okay, because you're going to be naturally high. If this is your range for like your normal, like 70 to 110, for example, the diabetic coma is up here. Okay, probably above my house, kind of a thing. But it's going to be of they're constantly eating or not burning or absorbing that sugar, so it just keeps building and building and building and building. Where it's not going to be of, oh, I ate half a cake today or whatever, and I'm going to go into a diabetic coma. No, it's going to be over a long-term thing. Where insulin shock, if this is your 70, insulin shock's going to come on around like 10, which is just right here. Okay, so you got to be really, really careful to not get too low. So insulin shock is really only going to happen when that diabetic person injects too much insulin, or just doesn't consume enough nutrients due to like activity, for example, or like fasting. Okay. People that play athletics, this is very, very important that they have to really monitor their insulin levels to make sure it doesn't get too low. Okay. Usually type 1 individuals is the biggest issue here. Okay. If you know anyone who's type 1, Ask them how to play sports. Okay, it's very, very difficult for some of them because they have so many extra steps that they have to do. Like when I was working in high school, I had a pitcher that was type 1 diabetic. Okay, every inning that he wasn't in there, he's just consuming food like crazy. Okay, to try and keep his blood sugars up. Okay, because he was a pitcher, which isn't as overly what's the word? He doesn't use like a ton of energy like a soccer athlete would, but he's still burning it like very, very quickly. Okay, like every inning he's having a PB&J and a Gatorade. Okay, just try and just like fuel him. The worst one I've seen was a wrestler. So if you've wrestled or know about wrestling, they have to maintain a certain body weight, okay, to wrestle at. Okay, and usually try to get to the lowest that's allowed. And there's like rules for that and so forth. A lot of wrestlers don't do it properly. They'll cut fast, throw up, take any kind of meds to help empty out their bladder and colon and everything like that. But wrestlers that are type 1 diabetic really have a real big issue of insulin shock. One I had at the high school, he was type 1 because he limited his diet. He did it correctly, best he could. But he would have breakfast, lunch, dinner, and snacks, but he'd have to eat candy just to get sugar, just to make sure he could just, I don't say live, but just kind of meet that kind of bare minimum threshold. That way he can function through schooling and everything else. And then the 3 bouts in wrestling, he couldn't last to the 3rd. He would get pinned. He'd just run out of gas so quickly. So he'd have to go pretty much 100% in the first 2 bouts. If he ever made it to the 3rd, he was always pinned. Always. Because he literally out of gas. Because there's not really any timeouts in wrestling. Like, there is, but you don't really use them unless you have to, because you only have 2 minutes cumulative. So one time he got really low. We had emergencies. Like, he communicated with me in advance of, all right, before my match, I took my blood sugar. It was 300, which is pretty normal for him before an activity to be a little high because of stress. And it was like a nationally ranked match. And he was wrestling someone that was significantly better than him. And he was amazing. He pinned the guy in the 3rd. Was great. Everyone was super shocked by it. I believe that one ranked him in the state, kind of a thing. He took 2 steps off the mat and collapsed on me. And we had apple juice set aside for him for emergencies like that. Hopefully we didn't have to use it, but that's just the apple juice is the quickest absorbed sugar source, is juice usually. So we had that there. So he came off, or more like he fell on me. I took him 2 steps. He was still conscious, so I let him drink. The apple juice, the little packets that we had way back in the days, or if you have kids, had 25 grams of sugar per pouch. After he took the 25, after he took that, given it wasn't fully absorbed yet, he took his blood sugar, and it was 15. Okay, so just think how low he was. Given that it's not fully absorbed yet, that kind of brought him out enough that way he could start consuming other heavier sugar sources and food and so forth. And he was done for the day after that, because there's really no point in going farther for him. But it was very, very difficult for him to compete, because he liked candy before he started doing wrestling, but he didn't act towards the end because he did have to do that just to kind of survive the weight cuts. Okay, so that's one really kind of extreme thing to worry about. Diabetics is the insulin shock, and if they go unconscious, do not give them anything by mouth. Very, very important. because that's a choking hazard now. Only if they're conscious can you give them something, juice-wise. Do not give them insulin. You will kill them. Okay? So insulin lowers your blood sugar. Just know that. There is another... I draw a blank right now. There is a emergency shot that you can do to help raise someone's blood sugar. It's on the tip of my tongue right now. But it helps release blood sugar in your body so it can be absorbed. I will try and put it in the module. There's a little video of it, of how I can use it. But it helps raise your blood sugar levels by releasing sugar through your, not spleen. All right, I'll put it in there once I look it up. But that is also available for individuals that do become insulin shock and are unconscious. And that just kind of gives them just a lift high enough that way they can kind of regain consciousness and start consuming better items. All right, some other disorders. Epilepsy. Okay, epilepsy is defined as recurrent paroxysmal disorder of the cerebral function characterized by periods of altered consciousness, motor activity, sensory phenomena, or inappropriate behaviors caused by abnormal neural discharge. So epilepsy is multiple seizures. Long story short. Okay, a person has seizures, usually pretty often, depending on the individual. That there's something just not quite right with their brain. Something's not processing correctly. It's causing this epilepsy. Usually people that are epileptic have like a trigger. Not all the time, but usually they do. And they'll have an aura. Okay, so the trigger can be something that's going to be specific to that person. Like one person I knew that her trigger was taking a nap during the day. If she took a nap, she would have a seizure like 3 or 4 hours later. Okay, and then she would have this aura that something bad is going to happen. This like sixth sense that something like a seizure is going to happen. So most people that have epilepsy or seizures have this aura, and they know. Excuse me. And they'll like, if they're driving, they'll pull over, they'll sit down. And usually like they'll tell someone, so like no one like freaks out like horribly. Like, hey, I'm gonna have a seizure. Don't freak out. And they'll make it that way they can't. They're not gonna hurt themselves further when they do this. So the person that is epileptic or has a seizure has periods of altered consciousness, motor activity, and a lot of times inappropriate behavior. What it's caused here. Come on. Can last 5 to 15 seconds for a petit mal seizure, or longer for a grand mal seizure, depending on whichever one it is. They will be unconscious, and uncontrolled tonic-clonic muscle contractions. So the tonic-clonic is that kind of jerking. It's a contract relaxation of the muscles. Individuals that experience daily or weekly seizures should be prohibited from participation in collision sports, because a blow resulting in unconsciousness can result in a serious injury. Must be careful with activities involving changes in pressure, and can be managed pretty good with medications. Okay, but they got to be taken every day. Okay, whatever the med is. Usually, once they have the seizure, excuse me, once they're kind of done like seizing, doesn't mean they come back consciousness 100%. They'll come back to being conscious but not awake, if that makes sense. So their eyes will be open, they'll be looking around, but their brain hasn't like kicked on yet, that they're not processing everything yet. Okay? So as a result, they're going to be very confused, angry, disoriented. They're not going to know who they are, where they are, anything. And usually it takes about 15 minutes for everything to kind of come back. Okay. They could lose control of their bladder. They could have a bowel movement. And nothing that they can control. It just happens. So whether they did or not, they're going to be really, really embarrassed. First thing I do is get up and get somewhere private. Okay? So what we can do is kind of keep everyone out of the area. If it happened in a kind of classroom, get everyone out. You know what? We're going to move class outside. That kind of thing. Just keep it to just the key individuals. Okay? I wouldn't like move them per se, but try and like have it so it's more of a private. Okay? For just the people that need be. Probably call 911 because you don't know what happened usually. Check for medical jury to see if they are epileptic or not, or it's just a random seizure. Because that does happen. Most places that have a seizure will have a kind of seizure protocol for that individual. Be like, all right, if it's under like 15 seconds, we don't need to call 911. We'll just kind of rest them and so forth, or take meds or whatever it is. But if it happens for like longer than like 15, 30 seconds, then just call 911 or just call 911 in general. Okay? Not a bad thing to do. One big thing about seizure, there's a few big things. When they do have that seizure, let's say they didn't have an aura, which happens. How did they fall? Did they hit their head? They hit something else. They crash, whatever it was. Half the seizures I've dealt with, which has been quite a bit, they've fallen, hit their head on concrete, on a desk, something like that. So now we have a head wound with possible other concussion symptoms. I didn't follow that far off with them from that fall. Okay, so that's very, very important. Second thing is when they're having a seizure, don't put anything in their mouth. Okay, they're not going to choke on their tongue. That's kind of a myth. What they can do is they can throw up or like start like drooling. So you'd want to turn them on their side and put like something under their head so they're not like repeatedly hitting their head against the concrete or flooring. So just turn them on the side. So what people thought was them swallowing their tongue was them kind of throwing up or drooling, and then they're drowning in their own saliva because now they can't breathe. But they can't do anything to protect themselves as a result. So just turn them on the side. Don't restrain them. Okay. I'll just stand I'll kneel like behind them and just kind of keep them on their side. Let them finish their seizure. Don't put anything in their mouth. Don't hold their mouth open. Don't stick your finger in your mouth. You will lose a finger really, really easily. Just turn them on their side, call 911, get everyone out of there, and just let it happen. Okay? Best thing you can do. All right, hypertension. Okay, so primary hypertension accounts for 9% of all cases, with no other disease associated. Secondary hypertension is associated with kidney disorders, overactive adrenal glands, hormone producing tumors, narrowing of the aorta, pregnancy, and medications. Long-term cases increase the chance of premature mortality and morbidity due to coronary artery disease, congestive heart failure, and stroke. Okay, so hypertension is high blood pressure, just so you know. Okay, signs and symptoms. Okay, primary hypertension is generally asymptomatic until complications arise. So asymptomatic is they have no symptoms at all until something else happens. Okay, may cause dizziness, flushed appearance, headache, fatigue, epistasis, and nervousness. Epistasis is a really fancy name for a nosebleed. That's all it is. Measurement. Thorough examination must be performed to determine type of hypertension and extent of hypertension. Medication is not recommended for those with pre-hypertension. Like the normal, the pre-hypertension is 120 to 139. for your systolic blood pressure, and your diastolic blood pressure is 80 to 89 millimeters per mercury. Okay. So usually the normal blood pressure is 120 over 80. You guys all heard that. Everyone's is going to vary slightly. If prehypertension is an issue, okay, lifestyle changes should be made. Individuals with stage 1 and stage 2 hypertension should be medicated. And like stage 1 is higher than 140, I think it's like 140 to 150. And stage 2 is above that. Okay. You can have lower blood pressure than 120 over 80. That's perfectly fine, normal. Usually people that are in better shape or in normal shape, they're going to have lower blood pressure. Like my wife's is normally about 105 to 110 for her systolic, and that's normal for her. 120 for her is really high, and she starts to not feel good. And that's just for her. Everyone's a little different. Anything over 140 disqualifies you from clearing a physical. Okay, so that is a thing. So if you're doing like athletics and if your blood pressure during your physical is over like 140, you're disqualified until you can get that blood pressure down. Okay. Which is strange enough, but during physicals, athletes like to come in drinking coffee, which increases blood sugar. Eating, like currently, any eating within like 2 or 3 hours of your physical can increase your blood pressure. They just worked out, which will obviously increase your blood pressure, and so forth. But the best way to decrease your blood pressure or your hypertension is to cardio is a big one. Diet, lower your salt intake are the bigger factors there. All right, STDs. All right, chlamydia. Okay, chlamydia is caused by a bacteria. Okay, signs and symptoms may result in pelvic inflammation and is an important cause of infertility and ectopic pregnancy in females. So ectopic pregnancy is pregnancy that it is not in the right spot. Okay, so that fertilized egg is not bound to the uterus wall. It's usually stopped in one of the ducts or somewhere else. Okay, can cause extreme pain and possibly complications associated with death. Okay, males, inflammation occurs in a petulant discharge up to a month after intercourse. Painful urination, traces of blood and urine, and vaginal discharge. Can cause conjunctivitis and pneumonia in newborns. Management is treatment with antibiotics. All right, herpes. Caused by type 2 herpes simplex virus. Signs and symptoms, okay, 4 to 7 days following sexual contacts. About 2 to 3 weeks being as a crust. Females may be asymptomatic while males will experience itching and soreness. You can develop lesions. Management, no cure. Symptomatic medication, which is kind of antiviral medication to lessen early symptoms of the disease. So there is also, okay, given this I'm talking about is sexually transmitted like herpes. There is also herpes gonorrhea, which is really common in like wrestlers and like sports in general, which is just herpes still, but it's through skin-to-skin contact and not through sexual contact. And this is more the herpes you're going to get somewhere in the body, chest, shoulders, arms, wherever it is. It's still herpes. And while nothing's going to affect you like sexually wise, like you're not really going to have like the pain on like urination or anything like that, but you will see like the herpes kind of spots appear up. Okay, So for a lot of people, let's say you like wrestlers, and I don't want to pick on wrestlers, but this is more common in wrestlers, that they usually are pretty prone to it, and like they know it, and they see a dermatologist, and they have the antiviral medications, and then when it shows up, they just don't do any wrestling until it goes dormant, and then this life goes on. Once you have it forever. But the antiviral medications just help it go dormant for longer periods of time. I always screw up on saying this. Trichomoniasis, okay, caused by a flagellate protozoan. Okay, it is a parasite. Sign symptoms, okay, vaginal discharge that is a greenish, yellow, and frothy. Okay, hope you're not watching this before you're eating. Okay, cause irritation of the vulva, perineum, and thighs. Okay, painful urination. Males tend to be asymptomatic, okay, so no symptoms, but may experience purulent urethral discharge. Okay, management. Complete cure is required before engaging in intercourse, which is just going to be through medications. All right, genital candidiasis. So this is a fungal infection transmitted through sexual contact and appears as warts on the glans penis, the vulva, and anus. Signs symptoms: cauliflower-like wart, or can be singular. Soft, moist pink or red swelling that covers that cauliflower-like head. Maybe mistaken for syphilis or carcinoma. Management. When moist, prescription meds is best. If it's dried, it may be frozen with nitrogen, liquid nitrogen. Okay, like here, I thought I had a picture. All right, gonorrhea, also known as the clap. All right, I don't know why I got the clap. Etiology caused by a gonorrhea bacteria, which is spread through intercourse. Signs and symptoms: in men, experience tingling of the urethra following by 2 to 3 hours of greenish yellow discharge and painful urination. 60% of women are asymptomatic. Females will experience vaginal discharge. May result in sterility if not treated. Management is just to be penicillin. Okay, avoid sexual contact until it is known that the disease is no longer active. All right, venereal warts. Okay, transmitted through sexual contact. Obviously, it is a virus. Signs and symptoms: appears on the glans penis, vulva, or anus. A nodule, cauliflower-like lesion, or can be singular. Start out soft, moist pink or red swollen. Develops a stem rapidly. May be mistaken for syphilis or carcinoma. Again, when moist, prescription meds, and then liquid nitrogen if it is dried. And there you go right here. All right, syphilis, bacteria that enters the body through the mucous membrane or skin lesions. There's 4 stages. Stage 1, 3 to 4 weeks incubation, but could be anywhere from 1 to 13 weeks. Painless ulcer forms within 4 to 8 weeks. Can occur on the penis, urethra, vaginal, cervix, mouth, hand, foot, or eyes. Second stage is 6 to 12 weeks, characterized by a rash, lymph swelling, body aches, mild-like flu symptoms, possible hair loss. Stage 3, characterized by deep penetration of bacteria that can damage skin, bone, cardiovascular system, and nervous system. And stage 4, late stage, may develop within 3 to 10 years of infection, may cause neurosyphilis, muscle weakness, paralysis, and various kinds of psychosis. Management is penicillin. Other drugs may be required due to increased resistance. But usually you get it early and it's not going to go to like stage 3 and 4. And there's what it looked like right there. All right, menstrual irregularities. All right, so strenuous training can alter the cycles. Okay, 25, 38 days long cycles. Um, Oligomenorrhea, okay, is a diminished flow. Refers to fewer than 36 cycles per year. Okay, menorrhea is a complete cessation of your cycle. So ovulation is seldom or not at all due to low levels of estrogen in circulation. Okay, menorrhea, okay, so is primary amenorrhea is female has not had menstrual period by age 16. Secondary amenorrhea is occurs when menstrual period stops for 3 to 6 months. Often is a hypothalamic dysfunction. Hormone release is deficient. Must rule out pregnancy, obviously. Abnormal reproduction or genital tract, as well as ovarian failure and pituitary tumors. The signs and symptoms is complete cessation of menstrual cycle. Depending on the cause, females may also experience headaches, blurred vision, hair loss, excessive facial hair, milky nipple discharge, and so forth. Management, okay, obviously, like, see your doctor about everything. Good evaluation. Nutrition is also really important for this. Reduction of exercise intensity and emotional stress may be needed. Estrogen replacement may be considered as one of the treatments. All right, next one is dysmenorrhea. Okay, this is a painful menstruation prevalent in active women. May be caused by hormonal imbalances, ischemia of the pelvic organs, endometriosis. Most common menstrual disorder. Signs, symptoms: cramps, nausea, lower abdominal pain, headaches, occasional emotional variabilities. Management: mild to vigorous exercise may help. Dysmenorrhea are usually prescribed. Continue activity as long as performance levels do not drop. Contact your doctor. Make sure it's nothing worse, obviously. All right, next is ovarian cyst. Okay, caused by a follicular cyst, fails to open and release the egg. Forms within one of the ovaries. So small fluid-filled sac. Most are benign. May cause bleeding, pain. It can grow pretty big. Causes may include early menstruation, irregular menstrual cycles, increased upper body fat distribution, hormonal imbalances, ovarian cancer, breast cancer, spreading all over the ovary. Okay, some symptoms may have little to no symptoms. May experience dull ache, low back pain, problems with urination, pressure, breast tenderness, nausea, vomiting, feeling of full pain in the abdomen, weight gain, painful menstrual periods, pain during intercourse. Management: pain relievers, NSAIDs, again, non-steroidal anti-inflammatory drugs, oral contraceptives, limit strenuous activity to avoid cyst rupture. If pain, fever, vomiting, faintness, dizziness, weakness, or rapid breathings develop, physician, obviously, or ER. And you may need a laparoscopic surgery to remove or correct any kind of torsion of that ovary or the cyst. Bone health, osteoporosis. Decrease in bone is seen commonly in older women. It is linked to a decline in the follicular it's luteinizing hormone and follicular something hormone, progesterone and estrogen. Okay, all these are important during a woman's life cycle, and they'll go up and down and affect everything. Physically active women with irregular menses, irregular cycles. Okay. Signs, symptoms: increased risk of stress fractures. Okay. Decreased bone mineral density. Okay, because your bone has now absorbed. Your bone is getting rid of all the calcium so your body can use it. So it's becoming just more brittle. Management: decrease training volumes, increase caloric intake, increase calcium supplementation, estrogen replacement therapy may be needed. All right, next is the female athlete triad. Okay, this is a relationship between a eating disorder, amenorrhea, and osteoporosis. Okay, this is the triad, all three. Often seen in females driven to meet standards of sports or to meet specific athlete image to attain the goals. Okay, so signs and symptoms: the eating disorder, bulimia or anorexia, osteoporosis, premature bone loss in young women, inadequate bone development. Prevention is key for some of this. Identify and educate. Okay, so this is not like a one person's going to fix this. This is a group of individuals to help this young individual. Okay, one, you're going to need MD consult, nutritionist, psych services. Not saying that they're crazy, but this is to help overcome that. Usually that, what do I want to say it as? That body image issue. Okay, that's always a big one. It's usually causing that bulimia or anorexia. Okay, it's usually that body image issue, which is the sports that are common with this is like cheer, gymnastics, swim and dive, track and field. Really most sports nowadays, but it used to be just like cheer was the big one. But now it's really all sports. You can see this. And the difference between bulimia and anorexia. So bulimia nervosa is emotional disorder, distorted body image, excessive desire to lose weight. So extreme eating followed by a self-induced purging. And anorexia is lack of or loss of appetite for food, obsessive desire to lose weight by refusing to eat. All right, so next a little bit on childbirth. Okay, so there's, for one, a woman is pregnant for 10 months, not 9. Okay, a woman's pregnant for 40 weeks, roughly, okay, which is equal to 10 months. Okay, there's 3 trimesters. The first one is 1 to 12, second is 13 to 26, and last is 26 to 40. Okay. Another good website you guys can use is American Academy Pediatrics and healthychildren.org, which is a really good one, especially if you're like a new parent or whatever. Very, very good, solid information, not Facebook, great aunt, this is what I did back in the day, kind of thing. Breaks it down, really easy to search for stuff for every stage of development for children. Okay, the very, very good website. Highly recommended. American Academy of Pediatrics is also good. It's linked to the Healthy Children. So stages of labor usually happens between 37 and 42 is when the child is born. Okay, that's roughly kind of like the normal range. It can go a little bit earlier. It can go a little bit later. Usually, they're not going to wait till after 42 weeks. That's usually have worse issues, and we'll just induce it then. So stage 1, the first 12 to 24 hours of labor. Okay, contractions begin. 30 to 70 seconds each. Cervix, the lower end of the uterus, opens. During contractions, the uterus and abdomen become tighter and firmer to try and squeeze that baby out. Between the contractions, the uterus will soften and relax to try and just like slowly pump that baby out. Stage 2 is delivery. Okay, so normal position, the head engaged next to the cervix. When head is expelled, position the shoulders to allow the mother to push it out. Sometimes they'll use like Vaseline. I mean, some of this is like emergency delivery, so I apologize. Back from my EMT days, Vaseline in the lip, the vagina, so because it will kind of rip. If you do happen to have the baby come out and you're like just side of the road or wherever you're at, keep the baby clean, flick the baby's foot, make sure it's responsive. Suck fluid from the baby's nose and mouth. Make sure it doesn't have any problems breathing, so forth. Delivery can be tricky at times. You want to make sure the head comes up first. If the feet come up first, that's called a breech. That is very, very dangerous for the baby, and do not recommend it at all. So stage 3 delivery is delivery of the placenta. Okay, so after the baby comes out, then you have to deliver the placenta. So this is where they would clamp 2 spots on the umbilical cord. Okay, and usually like the father would cut it, and then the placenta, which is the kind of connection piece to like the mother's womb, gets delivered. Okay, it comes out after the fact, and usually you can help it kind of detach a little bit by like gently massaging the mother's stomach, gently. It'll detach on its own. It's pretty normal. And that gets delivered. They'll store it because it has a lot of genetic information on there. Really, really important for the baby. Some cases the placenta can detach prematurely, which is very, very dangerous for the mother and the child, especially before birth. Very, very dangerous. High chance of death for both as a result. So that is not uncommon, that can occur. Those are roughly the 3 stages in a nutshell. Obviously, you're not going to be doing this yourself. Hopefully, you're going to have one of the doctors and the nurses doing everything. Ask questions. Whatever you got. Everyone's birth is different. Okay? Whether it's cesarean or natural, meds, other issues associated with it, whether it's like high blood pressure, gestational diabetes, which is diabetes in pregnant women, that literally stops the moment the child is born, and so forth. So, I mean, like there's major professions associated around childbirth, so this is like the quick, dirty version of it. And stage 4, okay, is care for mom and baby. Okay, so like a check airway, breathing, circulation, control any bleeding from mom, which after birth can continue on for the next few weeks. Skin-to-skin contact with baby and mother is very, very beneficial, or skin-to-skin contact with baby and father, whoever it is. Oftentimes, baby will have a bluish skin on newborns once they're born. It's common. Nothing really wrong with that. A lot of time, the baby won't eat for the first 24 hours. Okay. And then the initial stool, which is like the poop of the baby, is going to be black. Just know that. It's kind of weird. And doesn't smell. Okay, they're just trying to secrete everything that they kind of had in the womb. Delivery complications. Okay. Persistent bleeding. Prolapse umbilical cord, so it gets like caught, snagged, whatever it is. Breech birth, which is like feet come out first. Multiple births can be a complication. Cesarean is usually a fallback to this. Some people have the cesarean, just that's their plan, especially like with multiple births. They'll have emergency cesarean or C-sections because of like a breech birth or some kind of umbilical cord issue or whatever the issue is. Just know that. And that is it for Gen Med.